Hi guys.
Today we are going to study about the bone of the sternum. Here I already draw the sternum here, and now we are going to the parts of the sternum. Here there are three parts of sternum: manubrium parts, body, and the xiphoid parts. Now comes to the manubrium part. Manubrium is quadrilateral in shape, and it is the thickest and the strongest part of the sternum, and it has two surfaces, anterior surface and the posterior surface. Here posterior surface, and it has four border: superior border, inferior border, two lateral border. Here two lateral border, here superior, inferior, and the two lateral border. Here two lateral border. Now this was something you need to remember about it. That is, anterior surface is convex from side to side, convex from side to side, and concave from above downward, concave from above downward, convex from side to side. And the posterior surface is concave, concaves. I already write about the identification point of manubrium here. Let's see. Then now come to the border. The superior, it has four border. I already tell you. Now comes to the border. This is the superior border. Superior border, here superior border. It is thickest, rounded, and concave, and it is marked by suprasternal knots. Here, suprasternal knots. The superior border is thickest, rounded, and it is concave, and it is marked by suprasternal knots, or you can say jugular knots. Same. On its side, there is clavicular knots. Here, there is clavicular knots. Clavicular notch. The clavicular notch on its side is articulate with the median end of the clavicle. Median end of the clavicle, which form sternoclavicular joint. Now comes the inferior border. Inferior border, here, the inferior border. Inferior border is forms secondary catenarized joint with the body of sternum. Here the body of sternum, body of the sternum and the inferior border of the manubrium, which forms secondary cartilaginous joint. Then just below the inferior border of the manubrium, there is angle. Here the angle is called sternal angle, or you can say angle of Lewis. Now come to the muscle attachment of the manubrium. Already write about the muscle attachment here. There is sternocleidomastoid muscle, and on its side pectoralis major muscle. This is the attachment of the anterior surface of the manubrium. Now come to the posterior surface of the manubrium. Here there is posterior surface. The posterior surface of the manubrium, the muscle attachment is two part: upper part and the lower part. Upper part is sternohyoid muscle, and the lower part is sternothyroid muscle. Here, see, sternohyoid and the sternothyroid. Now comes to the relation of it. On the posterior surface of the manubrium, it is related with on the upper half and the lower half. Upper half is related with left brachiocephalic vein and left brachiocephalic artery, left common carotid artery, and the left subclavian artery. On the lower part, on the lower half of the posterior surface of the manubrium, it is related with arc of aorta. Here you can see here you can see left brachiocephalic and left brachiocephalic artery and vein, common carotid artery, subclavian artery, and the lower part arc of aorta. Comes to the body of the sternum. Here this is the body of the sternum. You can identify the body of the sternum by it is longer, it is narrower, and it is thinner. It is thinner than manubrium. Manubrium is thickest, but the body of the sternum is thinner, and it is the widest. It is lowest part, close to the xiphoid process. Now come to the surface of the body of the sternum. Body of the sternum has two surfaces: anterior surface here, anterior surface here. anterior surface, posterior surface, anterior surface, posterior surface, and it has two lateral border here, two lateral border, one lateral border on this side, one lateral border on this side. Now comes to the end. It has the body of the sternum has two ends, upper end and the lower end. There's two ends, upper end, lower end. The upper end form secondary cartilaginous joint. Say upper end forms secondary cartilaginous joint with manubrium at the sternal angle. Sternal angle with it forms secondary cartilaginous joint with manubrium. Here is manubrium. It forms secondary cartilaginous joint with manubrium at the sternal angle here, sternal angle. And lower end form primary cartilaginous joint with Ziffy sternum. Here is Ziffy sternum. And its lower end is here. Lower ends form primary cartilaginous joint with Ziffy sternum. Now come to the muscle attachment of the body of the sternum. Here, muscle attachment of body of the sternum. Then it has two surfaces. I already said it has two surfaces, anterior surface and the posterior surface. On the anterior surface, pectoralis major muscle here. It is pectoralis major muscle here. Muscle attachment here, pectoralis major muscle. It is the continuous of the manubrium. Here, the pectoralis major is also the attachment of manubrium on its side. It is continue as the muscle attachment of body of the sternum. You want to know? Anterior surface of the body of the sternum has muscle attachment is here, pectoralis major muscle here. Now come to the posterior surface of the body of the sternum. On the posterior surface of the body of the sternum, the muscle attachment is sternocostalis muscle. There is only one muscle that is attached here. This is sternocostalis muscle on its lateral side here. Come to the relation of the posterior surface of the body of sternum. On the right side here, this is right side and this is left side. All the right side of the body of the sternum is related with the anterior border of right lung and pleura. Anterior border of right lung and pleura. It is the relation of posterior body of the sternum. Now come to the left side. Here is its left side. On the left side, the relation is divided into upper half and the lower half. The upper half is related with the left lung and pleura. Upper half is related with the left lung and pleura. And the lower half is related with the pericardium. The lower half is related with the pericardium. Okay, let's go to the next part, that is xiphoid part. You can identify easily. Now come to the muscle attachment of the xiphoid process. On the anterior surface of the xiphoid process, the muscle attachment is rectus abdominis muscle here. Here you can find the muscle attachment of rectus abdominis on the xiphoid process here. See. Now come to the posterior surface of the xiphoid process. On the posterior surface of the xiphoid process, there is two muscle attachment here, diaphragm and the sternocostalis muscle. Thank you guys.